this is a preview of coming attractions on rationing if the Democrats' health care reform legislation passes. The senator, one of the biggest advocates for breast cancer research, joining me right now. She's also a candidate for governor of Texas. Senator, good to have you.
Thank you, Neil. Thank you.
Where does this stand, this whole issue of mammograms, and whether in a reformed environment, whether it's going to be what the Senate is looking at right now or a watered-down version, this is going to be covered?
Well, Neil, what's bad about this is this very same task force that all of a sudden changed the guidelines that we have had for years in our country is the task force that is being a part of the reform bill that is going to be making the guidelines for this new government option program that the Democrats are putting forward. And so it's the very same task force that all of a sudden is changing the guidelines to clearly save money. That is the only thing that is motivating this. So if that doesn't mean that rationing is coming, I don't know what does. Okay.
Now, I'm just curious, the timing of all of these studies, this went back to the PSA, tests that have been maybe not so urged for men now, the timing of that study coming out, the timing of the mammogram study. What are they laying the groundwork for?
Well, it's clearly they are laying the groundwork for less coverage and fewer options that a woman and her doctor or a man and his doctor can decide for themselves, because they're putting a government task force, a committee in place of the decisions that we now make between ourselves and our doctors. That's what it means. And of course, going forward, once that is in the government option, you know that the private insurance companies are going to follow, because they're going to be competing with the government option, and they're going to have to cut costs too.
Senator, well, I have you here tomorrow. I'm going to be in Washington. I'm going to be watching this job summit at the White House. And I'm sure this health care issue is going to come up, and the president is going to tell a lot of the CEOs assembled there that this is in your best interest to do. What do you think of that pitch?
Well, we are trying to create jobs in this country. We have a $2.5 trillion bill that is going to add costs to every business in America, and it's going to tax every person in America if they don't buy health care on their own, if they don't get it in their business. It's going to mean employers are going to have to cut back. They're going to have to pay fines. Is that the environment we want when we're having a job seminar at the White House? Do we want to have a bill that's going to put more costs on business and actually cut jobs? It just is, it's counterintuitive, and I don't see how they can, with a straight face, say that all these taxes and mandates on business, the cuts in Medicare, the $2.5 trillion add to our debt, could possibly be good for our economy and help create jobs. It just doesn't work.
Senator, thank you. Always good seeing you.
Thank you, Neil.
Senator Hutchison of Texas. So the Senate is working on a health care overhaul that is